Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today, we're going to talk some more about acne. So last time, we took a high-level view of acne, and now I want to get into the nitty-gritty of what these specific terms are. So if you were as surprised as I was that whiteheads are not what we typically think of whiteheads, but rather are called pustules, what we think of whiteheads are pustules, and what are actually whiteheads are these skin-colored bumps, then we are going to go ahead and dive into that today. So first up, what are blackheads? So blackheads are the small bumps that show up on your skin because your hair follicles are clogged. Those bumps are called blackheads because the surface looks dark or black, and they're usually a mild type of acne that forms mostly on the face, but you can also get them on your back, chest, neck, arms, or shoulders because you have that peach fuzz or that hair all throughout your body. So anywhere you have a hair follicle, you can get blackheads. Now, acne in general affects about 50 million Americans per year, and it's the most common skin disorder within the United States, and that is according to the American Academy of Dermatology. So, what causes blackheads? They form when you have a clog or a plug in the opening of the hair follicle in your skin. So each of these follicles has one hair and a sebaceous gland that produces oil. They're called sebaceous glands because the oil is called sebum. And that's really why it's called a sebaceous gland, because it is your sebum that is there to help keep your skin soft. But dead skin cells and oil also collect in that opening for the hair follicle, and that can produce a bump that is called a comedo, as we discussed in our previous episode. If that skin over the bump stays closed, then the bump tends to be called a whitehead. But when the bump opens, or the skin over the bump opens, then exposure to the air causes it to look black, and a blackhead forms. So personally for me, blackheads are the bane of my existence. I don't tend to get the other types of inflammatory or non-inflammatory acne. Remember, blackheads and whiteheads are non-inflammatory acne, but I do get blackheads, especially around my nose. So some factors that can increase your chances of developing blackheads and acne in general include producing excess body oil, buildup of the Propionibacterium acnes bacteria on your skin, and the irritation of your hair follicles when those dead skin cells aren't shedding correctly on a regular basis. Also, it tends to happen a lot to teenagers because they're having a lot of hormonal changes that can also cause an increase in the oil production, especially during menstruation if you have a uterus and you are someone who menstruates, or if you're taking birth control pills. Also, if you take certain types of pharmaceuticals like corticosteroids, lithium, or androgens, then you may also develop more of that body oil and have more blackheads. So a lot of folks think that what you eat or drink can affect your acne. Dairy products in particular are thought to increase your blood sugar levels as well as carbs in general. And that may play a part in triggering your acne, but researchers really aren't convinced that there's a strong connection. So just as we discussed in our previous episode, you don't have to just knock out a whole food group just because you think it might be triggering your acne. You're welcome to do whatever is comfortable and safe for your body, but the research doesn't support that. Enjoy your pizza, you guys. Enjoy cheese. In general, what are the symptoms of blackheads though? Blackheads are easily the easiest to spot on your skin because of their dark color. A lot of times they're slightly raised, but they don't really hurt us because they aren't inflamed like pimples. Remember, blackheads and whiteheads are non-inflammatory acne. Pimples tend to form when you have bacteria in your body that kind of blocks the hair follicle, and that can cause redness and inflammation, and at that point develop into inflammatory acne. You can treat blackheads in a variety of ways though, and that is the good news. First step is over-the-counter treatments. So a lot of acne medications are available for you to get at drug and grocery stores or even online without having to have a prescription from a doctor. You can get creams, gels, or pad form. You can also go ahead and apply them directly on your skin in a variety of ways. So I have some that are kind of a paper form with a little bit of perhaps a gel that's on them. So you wet your nose first and then you go ahead and put the little paper on it, and then it helps to remove some of those blackheads. Most of these are going to contain specific ingredients like salicylic acid, benzoyl peroxide, or resorcinol, and we discussed these in the previous episode. The TLDR is that these work by killing your bacteria. They also dry excess oil, and they force your skin to shed those dead skin cells that are clogging up your pores. You can also get prescription meds though. If over-the-counter medication isn't helping with your acne, then your doctor might suggest that you use some stronger prescription meds. These tend to contain vitamin A, and that helps keep the plugs from forming in your hair follicles, and it helps you to have a quicker turnover of those skin cells. So as those skin cells die, it helps to go ahead and shed them. Those meds are typically applied directly to your skin and include tretinoin, which is not to be confused with tritonin, which is what the Gold in Stargate SG-1 are really using, or rather the Jaffa are using to prevent their reliance upon the Gold, tazarotene, or adapalene. So your doctor may also prescribe other types of medications that you can spread on your body. Those are called topical medications, and those typically contain benzoyl peroxide and antibiotics. So antibiotics, remember, those affect specifically bacteria. So you're trying to get rid of that bacteria that's causing the acne. So this topical antibiotic is going to really help you out. If you have pimples or cystic acne in addition to your blackheads, that type of medication with the benzoyl peroxide and the antibiotics may be particularly helpful for you. In addition to medication, you can also manually remove these blackheads. You want to avoid trying to do that yourself in most cases because there's a specific way it needs to be done so that you don't contaminate other parts of your pores that are not already contaminated as well. So dermatologists or other folks who are specifically trained to care for your skin may use a special instrument called a round loop extractor, or you may have seen it on YouTube with Dr. Pimple Popper and some of these other dermatologists as being referred to as a Komodo extractor, to remove that plug that's causing the blackhead. After you make a small opening in that plug, the doctor may apply pressure with that extractor to remove the clog. Remember that if you do end up doing this at home, it's important that you open up those pores first. So go ahead and take a hot shower first, or put some type of a warm washcloth essentially on top of the area that's affected for a while in order to open up that pore. And once you're done with the removal, close that pore back up with cold water. We're going to go on a quick break, and when we come back, we're going to talk about some more removal methods, including microdermabrasion, chemical pills, and laser therapy. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Before the break, we were talking about blackheads, what they are, what causes them, and how we treat them. So now we're going to continue with how to treat them, starting with microdermabrasion. So in microdermabrasion, a doctor or skincare professional of another type will use a special type of tool that has a rough surface to essentially sand down the top layers of your skin. And sanding that down helps remove clogs that can cause blackheads. I am personally a big fan of microdermabrasion. I used to have a brush that worked by rotating it in a circle more or less, and you would also apply an exfoliant to your face, and it would rub that in to kind of sand down the top layers of your skin, your epidermis, and so forth. So I also like to sand down tables and stuff in my spare time. I like to build furniture, and I built my own desk from scratch as well. It is a mid-century modern build with a flat maple plank on the top, maple plywood plank, because mid-century modern uses a lot of plywood, as well as some chrome, or at least chrome-coated hairpin legs, to be at about the same height for someone of my stature. So you guys know I'm 5'2", and that's really important to keep in mind when you're building desks, because most desks are built for men who are of average height, so about 5'10" or so. That means it's way too high for me, and that ergonomically does not really work for my body. So it puts my joints, specifically my elbows and my wrists, at an unnatural angle for my body type. So mine is at about 24, 25 inches, whereas for men, it's going to be at about 28 inches for those men of average height. I also have mid-century modern chairs with these hairpin legs that I stained the table to be very similar to, so that they match. So for me, this works out very well. And microdermabrasion works a lot like sanding. So if you're familiar with woodworking, it essentially works the same way. You're removing a lot of those bumps, and you're just making everything smooth. In addition to microdermabrasion, you can also use chemical peels to help remove some of those clogs in your pores and to get rid of those dead skin cells that help cause blackheads. When you use a chemical peel, it's a strong chemical solution that you apply to your skin. And over time, those top layers of your epidermis peel off, and it will reveal a smoother type of skin underneath. A lot of times, if your skin feels bumpy or gritty, it's because you have some dead skin cells that are just kind of chilling on the surface. And we need to get rid of those in order to get to the base cells that are underneath. Some mild peels are available over the counter, but you can also get stronger peels from a dermatologist or other types of skincare professionals. Now that we've covered microdermabrasion and chemical peels, we can also talk about laser and light therapy. These use small beams of light to help you decrease your oil production in your body and or to kill bacteria. The lasers and light beams can both reach below the surface of your skin to treat those blackheads and acne without damaging those top layers of your skin, which is really important because we don't want to cause any scarring. Leaving the acne alone can also cause scarring, so we want to make sure that we are not also doing that by treating it. So how can we prevent blackheads? One of the best ways to do that is just to wash your face regularly. Do it when you wake up and before you go to bed to help remove some of that oil that's building up in your face over time. You can also wash more than twice per day, like when you're sweating a lot, but doing so can also irritate your skin and exacerbate that acne. So we only want to do that if we're sweating really badly. So the TLDR of this is that you just want to make sure that you're not irritating your skin or making your acne worse. Because in particular, making your skin too dry is also irritating your skin. If your skin feels dry when you touch it, that means it's irritated and you need to go ahead and add some moisture to it in order to keep it healthy. Dry skin can also make your acne irritated and worse. So you want to use a gentle cleanser that doesn't make your skin red or irritated. The same thing goes for those mud masks, those face masks. I've had one recently that I absolutely loved, but over time it just made my skin red and irritated and it broke out more afterwards. And it broke my heart because I absolutely love that mask. I liked how it made my skin feel and I love the smell of it too, but it actually made my skin worse overall, so I had to stop using it. And sometimes life's just like that, you guys. But keep in mind that a lot of acne cleansing products have antibacterial ingredients that can kill that P. acnes bacteria that we discussed earlier. Another thing that can really affect your skin is your hair. So keep that in mind. Washing your hair every day is really important if it's oily. You don't necessarily need to do that if your hair is dry or if it's kind of combination. So keep in mind that the type of skin that you have is not necessarily going to be the same as the type of hair that you have. But hair oils can overall contribute to how much your pores get clogged. It's also really important to wash your face after you eat oily foods because oily foods can clog your pores. Not in the dietary sense, but in the sense that you're getting it around your mouth and everything. So you want to make sure that you are cleaning that off of the area of your face in which the oils have had contact. In addition to that, use oil-free products if you can. Any product that has oils in it can contribute to forming new blackheads. If you are able to have an oil-free or non-comedogenic makeup or lotion or sunscreen, that can help you a lot. And remember, as we discussed in our last podcast, non-comedogenic means non-blackhead forming or non-pore clogging makeup or lotions or sunscreens. You can also try a product that exfoliates. Exfoliating scrubs as well as exfoliating masks can help you remove those dead skin cells from your face. And if they're not just sitting on your face, that means they are less likely to infect your pores. So you want to make sure that you're looking for products that don't irritate your skin and that are less likely to infect those pores, because if they're not infecting your pores, then they are less likely to cause blackheads in general. Blackheads, as I said, are the bane of my personal existence, and overall, we want to make sure that we are avoiding those. We're going to go on another quick break, and when we come back, we are going to talk about whiteheads and what orgasms can do for your skin. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Now we're going to talk about whiteheads and what orgasms can do for your skin. So orgasms in general do have benefits. You guys, we can totally say that an orgasm per day keeps the doctor away. They feel great for you, but it can also have a lot of benefits for your body, particularly on your skin. So if you're looking for a glow, you might see it next time you get off. I'm just saying, you guys, that's not just a line from the Julianne Moore and Pierce Brosnan movie, Laws of Attraction, which is one of my all-time favorite movies, but it's also science. So, have you ever in particular found that an orgasm tends to chill you out? If so, you're not alone, and it can really help maintain your skin. In 2000, a study conducted by Planned Parenthood found that 39% of U.S. women reported masturbating to relax, and that is 39% of that 2,632 U.S. women. Other studies have found that low levels of oxytocin, that bonding hormone that you find in breastfeeding or in orgasms, and it's in your bloodstream, are correlated with high levels of stress, tension, and anxiety disorders. The less oxytocin you have, the more stress, tension, or anxiety that you may experience. So when you're stressed out, a big organ like your skin, which is the largest organ in the human body, might actually take the hardest hit. So this can trigger stress inflammation like rosacea and psoriasis, but it can also trigger some annoying breakouts like those related to eczema or acne. Getting beauty sleep can also help a lot too. Doctors recommend having 7 to 9 hours of sleep to perform the maintenance that's necessary to help your skin stay glowing. The overall immune system in your body and the inflammation you experience helps heal you during sleep, and especially long stretches of sleep. So take advantage of that to help with the rollover and fall asleep right after you climax. I'm just saying, you guys, that's how it works. In 2009, the University of Michigan conducted a study and found that having an orgasm raises the levels of estrogen in your body. And that's good for you because estrogen actually appears to aid in the prevention of aging your skin in various ways. Firstly, it prevents a decrease of collagen. Collagen is particularly important for maintaining the appearance of youthful skin. It's a protein that's very important with maintaining the thickness of your skin, and that also keeps your skin resistant to wrinkles. So in regards to wrinkles, estrogen is particularly effective on the elastic fibers of your skin that prevents aging as well. Estrogen can also help lock in your skin's moisture and help keep your skin looking plump. Plumpness in your skin is very important. So a lot of times, I know because of magazines and whatnot, we think of plumpness as being bad, but it's not. It means that your skin is well hydrated. It helps you to have a glow and to keep you looking youthful. So if you're kind of wondering where exactly that post-sex glow is derived from, I'm going to tell you where it comes from. During sex, there is an increase in the rate of blood flow throughout your body. So that means that more of your blood cells are carrying oxygen to reach your face. When your blood vessels start to dilate, you start looking all rosy and beautiful, and an increased amount of oxygen stimulates that collagen production. So, hello collagen, goodbye wrinkles. I don't know her. Who are wrinkles? Keep that in mind. Science also supports the idea that having sex frequently or masturbating frequently, having an orgasm, is really where that's coming from. And affection also makes people happy. You're not just sleepy, you're stress-free and you're glowing. So if you're happy like that in the morning, then that is really good for your body. That smile also does wonders in making people think that you're younger. In 2016, they performed a study that showed that when people smiled, they were perceived as looking younger. Another awesome thing about the benefits of an orgasm on your skin includes that it doesn't involve any fancy or expensive creams or lotions or gels or so on. The best part is that you can have all the benefits of orgasming alone just as much as you can with a partner. So that is particularly helpful, especially in this era of social distancing. You don't need anybody with you to look young. Just get yourself off, you guys, and you will be good to go. It keeps your skin looking young. It's healthy for you in general. Don't let anyone make you feel like orgasming alone means something for you socioculturally. We are all sexual creatures, so go forth and get your glow on and go take you a selfie. Do you, bruh. That's what life is all about. It's about being happy, and you do that however you need to do it. Now, we're going to talk a little bit about whiteheads. So whiteheads are a type of acne that form when your dead skin cells, oil, and bacteria get trapped in your pores. They can be kind of annoying, but they're also about the same color as your skin. Remember, whiteheads are actually different from pustules. Pustules are what I think of when I think of whiteheads, where it has like a little bit of pus or that white type of material in it. But pustules are very different from whiteheads. Whiteheads are non-inflammatory, whereas pustules are inflammatory. A whitehead in general is a type of acne that forms on your skin when those dead skin cells become trapped in your pores. The good news is that they can be prevented, especially if you combine lifestyle changes with some medical treatments. So TLDR, the understanding of the cause of whiteheads can help you prevent future breakouts. Clogged pores are the primary cause of whiteheads in general. Your pores can also get blocked for several reasons. One of those is hormonal changes, which is why this particularly tends to impact people who are in their teenage years. and clogged pores are the primary cause of whiteheads. So if you have these, that can often be a trigger of acne as well. Different life stages can also increase the amount of sebum or of oil, as we've discussed before, that your pores produce, and that can cause clogged pores and whiteheads. That includes puberty, menstruation, and oddly enough, pregnancy. So remember, when you're pregnant, your body's going through a bunch of hormonal changes. And so you may have some acne along with that pregnancy glow that you guys get. And that's totally okay. Everyone's going through that, just as we discussed in our last episode, especially in context of the Netflix show, I'm Not Okay With This, and how the different characters get acne in different places regarding their thighs and their backs. It's okay, girl. It's totally normal if you are having some acne associated with your pregnancy. Nobody's going to judge you, especially fellow people who can become pregnant. We know. Don't even worry about it. Certain contraceptives can also lower your progesterone levels or heighten your progesterone levels, and can increase your hormone levels and cause acne flares in people who have a uterus. Also, a lot of times, some women notice more acne during certain stages of their menstrual cycle, and also once they stop taking birth control pills. So in my experience right now, you guys know I'll never lie to you. I'm always honest. And I've stopped taking my birth control pills for the time being because I don't need them right now for any reason. We're in a quarantine, you guys, and I am single and not ready to mingle. So I am just still buying my birth control pills, but not necessarily taking them right now. So I don't need them. And that is totally okay. But that also means that my skin may be more likely to suffer from acne at this time. Whiteheads can also appear in areas on your body in which you get a lot of friction, like on the chin, or in areas that you touch frequently, like on your face, or in places that have a lot of friction otherwise, like if you have breasts underneath your breasts, and so on and so forth. We're going to go on another quick break, and when we come back, we're going to discuss where whiteheads appear. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. In our last segment, we were talking about blackheads, how they develop, where they come from, and how to prevent and treat them, as well as how orgasms can help out your skin. So now we're going to talk about where whiteheads appear on your body. You can get whiteheads anywhere on your body. So your nose, your chin, and your forehead, your T-zone, are the most oily parts of most people's faces and may be especially prone to acne outbreaks. But you can also get whiteheads on your chest, back, shoulders, arms, etc. Acne happens with men and women and at just about any age. If you didn't have problems with whiteheads when you were a teenager, you can still have that at some point as an adult. So if we're going to treat whiteheads, they're relatively easy to treat, and that is the good news. One of the easiest ways to treat them is with a topical retinoid, but those sometimes take about 3 months to see any effect, and you need to be using them every day or night. So remember, as we discussed in our last episode, it's very important to be consistent in your usage of these treatments and that you are trying them for the long term to make sure you see the effects. Topical retinoids are generally used to prevent acne. We are not going to spot treat our pimples with them. So they work by ultimately preventing the pore clogging process. Make sure that you wear sunscreen every day because when you're using retinoids, it's going to make your skin more sensitive to the sun. So retinoids are like vitamin A. And vitamin A is pretty easily absorbed into the skin when you apply it topically, which is really great. And there are 2 types of vitamin A. You have retinoids, or preformed vitamin A, and carotenoids, proformed vitamin A. And both types are taken into your liver where they're converted to retinol. And then they either are stored in your body or transported by your lymphatic system to use in other cells throughout your body. Retinol is really good for your skin because it stimulates the production of new skin cells. And if you don't have enough retinol, then your skin can be super dry. So according to some research in the Clinical Interventions in Aging, a dearth of retinol can also cause follicular hyperkeratosis. And that's just a condition in which you have too much keratin in your hair follicles. So hyper, too much, or an excessive amount. Keratosis, keratin, really, you have an excess of keratin in your hair follicles. And that can cause those raised papules to form on your skin because that is where the pimples are coming from, is these hair follicles. So, we don't want those. If we have enough retinol in our skin, enough of these retinoids, vitamin A, then it can help prevent that excess of keratin that is creating those whiteheads. You may already be familiar with the use of retinol for stimulating collagen production and working on reducing your wrinkles when you do use it topically as well. So they're really a good thing for your skin. You want to make sure you're getting vitamin A in your diet, but you can also apply it topically. Your skin is super receptive to it, and it's really happy to get excess vitamin A. If you want to get retinoids from animal products, from eating rather, then you can get that in salmon, beef liver, dairy products like milk, butter, and cheddar cheese. And you can also get it from eggs, fish, cod liver oil, and shrimp. Remember, whenever we can get them in our food, that's what we should be going for instead of supplements whenever possible. But you can use vitamin A topically in addition to getting it from your food or a supplement. For acne, it's going to be super helpful, and it has an anti-inflammatory property as well. Additionally, it can help regulate getting rid of those old skin cells, and that can reduce problems with clogged pores. So you do want to make sure that you are using vitamin A safely. Too much of a good thing is still too much. So eating or applying too much vitamin A can have side effects for your body. And some of those include headaches, blurred vision, dizziness, liver damage, nausea, or even a coma. So this is the type of preformed vitamin A that we're talking about, these retinoids. A lot of times when we think about having too much vitamin A, we're thinking of those carotenoids. So getting too much beta carotene and turning your skin yellow or orange. But remember, the carotenoids are proformed vitamin A. So we were talking about the side effects associated with preformed vitamin A, those retinoids that you would be applying to your skin as well. In addition to that, Prescription retinoids can also cause more sun sensitivity. So if your dermatologist is prescribing you retinoids, it can cause your skin to sometimes be drier and sometimes to flake. The irritation is going to be less likely to occur if you ease into using retinoids slowly and gradually increasing the amount that you apply to your skin over time. You should definitely discuss that with your doctor. Now, because retinoids also stimulate cell growth, they can make your skin more sensitive to sunlight too. So you want to cover your skin during the day or use a sunscreen to make sure that you are not going to be as likely to burn. You also want to talk to your doctor about the type of sunscreen that you should use. A lot of them also have retinol as an ingredient in them. So if you're already using a prescription retinoid, that can actually further exacerbate irritated skin. So talk to your doctor about that, especially if you are pregnant or if you're planning to become pregnant, because if you have too much preformed vitamin A, those retinoids in your body, it can cause birth defects. I don't want to scare anyone, just making you aware of how this can be a problem if we are not using the things as they are described, and just encouraging everyone to be mindful about our usage of even things that we're topically applying to your skin. It's still absorbing into your body, and we want to make sure that we are using these things in a way that really helps us more instead of ends up harming us. In addition to using sunscreen and these retinoids, doctors may also prescribe oral contraceptive birth control pills, the combined form, in order to help reduce acne in women. To prevent acne and whiteheads, make sure that you're washing your face twice a day. And if you wear makeup, use cosmetics that are non-comedogenic or oil-free. If you're acne prone, those products might help you more because they don't tend to clog your pores, and that reduces the likelihood of getting whiteheads. You should also check your lotions and moisturizers to make sure those are oil-free and limit the amount of oil that is being applied to your skin in addition to the oil that's already there. Make sure you're washing your hair and your skin on a regular basis and remove your makeup before you go to bed. But avoid excessively washing your face because you don't want to actually irritate your face more. If you are using a cleanser, use a mild one and wash your face with warm water and then pat your skin dry instead of scrubbing. If you have an acne breakout, you should not be exfoliating your skin with any scrubbing products, and generally you should not be using masks either. Those can just worsen your acne at that point. All right, we're going to go on another quick break, and when we come back, we're going to talk about acne, papules, and pustules. Stay tuned.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Before the break, we were talking about whiteheads, and now we're going to talk about papules and pustules. So, inflammatory acne is the group that includes papules, pustules, nodules, and cysts, whereas non-inflammatory acne is what we covered in the first half of today's episode, and that includes blackheads and whiteheads. A lot of acne is just developing because a pore in your skin or your hair follicle becomes clogged with oil and skin cells, and then bacteria eat on that and they multiply. So preventing our pores from being clogged is going to prevent the proliferation of any bacteria that may be present. Specifically though, what is a papule? Well, that's just a small red bump, you guys. It's usually less than about 1/5 of an inch in size, and they don't have that white or yellow pus in the center. When a papule does collect pus, then it becomes a pustule. Most papules do become pustules, but it takes a few days for that to happen. Now, we really don't want to pop the pustules, even though it can be very tempting, because that can also spread the bacteria further across your face or the area in which you are having those pustules, and it can also cause scarring. If you are going to pop them, make sure that you do so in an appropriate way that is going to be healthy for your skin and reduce the risk of scarring. Or you have a doctor do it. So how do these papules form? Well, that excess oil and skin clogging that pore forms a blockage that is called a comedo. And the oil in that pore feeds the bacteria that is called P. acnes. This forms a micro version of those comedones we discussed before. You can generally see and feel it, and it can develop into that larger structure that we are already familiar with, those comedones. So if they rupture and disperse the bacteria into the skin tissue around the infected area, instead of just going out onto the surface of your skin, then your body is going to try to fight it with inflammation. And that inflammation is going to be in the form of a papule. That's why it is red. So with the papules, they can be caused by bacteria, excess oil production, and excess activity of androgens, those male sex hormones. It can also be triggered by, worsened by stress or certain medications like corticosteroids. To treat papules, your doctor will probably start with benzoyl peroxide or salicylic acid. Remember, those are good for inflammatory acne. And if those aren't effective after a few weeks, then your doctor may send you specifically to a dermatologist who can get you some stronger medications for it. If you have inflammatory acne, your doctor may also prescribe a topical retinoid or topical antibiotics as well. Remember, part of the problem is the clogged pores, and the retinoid is going to help you clear out those pores and make sure that you are sloughing off those dead skin cells as you should. And the antibiotics is going to kill the bacteria that feeds upon it to also reduce that redness. This is generally done in concert with other treatments. So they'll do erythromycin antibiotics with like a benzoyl peroxide type of topical cream, or they may use like clindamycin mixed with benzoyl peroxide, and that is called benzaclin. And other times they use antibiotics with retinoids. It just depends on the severity of your acne, but your doctor may also recommend oral medications like oral antibiotics, birth control pills, and anti-androgen agents for women. Now, if you have a papule and it's larger than that 1/5 of an inch, and it may seem to be particularly swollen and even painful, it might be an acne nodule instead of a papule. They're very similar to each other, but nodules are created deeper in your skin, and they are more hardcore than papules. They generally take longer to heal, and you're more likely to have a scar following the healing of the nodules. If you think you have nodular acne, the one that's deep down in the skin and bigger, go ahead and see a dermatologist. They can help you to get some relief from that and help you prevent scarring. So the TLDR of this is a papule is just like a tiny raised bump on your skin that's caused by excess oil and skin cells clogging a pore. That's really what most of these come down to, is excess oil and skin cells clogging a pore, and then bacteria feeding on it, that P. acnes bacteria, leading to these different types of acne. It's just the presentation, for the most part, that is different. Papules don't have pus that you can see, but when they do get pus, then they are turned into pustules. So those are two different things. Papules are a symptom of having inflammatory acne, and you can get over-the-counter or prescription treatments to treat papules. Just depends on the severity of them. And if those over-the-counter treatments aren't working for you after consistently using them for a few weeks, go ahead and talk to your dermatologist. For the pustules, what exactly is causing those? Well, that is generally caused by hormonal imbalances or hormonal changes in your body, and it's a very common skin condition. So you can usually treat them with medication. Pustules can form not just from acne, but whenever your skin becomes inflamed from like allergic reactions to food, environmental allergens, or getting poisonous insect bites. So if you've ever been bitten by a fire ant, then that is why it looks like a pimple at that point. Those suckers hurt. It's not great to be bitten by fire ants, you guys. I've been bitten by several in my time in Texas. And it looks just like little pimples until they heal. That's because those are pustules. They're just a pustule from a different cause. But the most common cause of pustules is acne. When you have an infection in that pore cavity, then they create pus as a response of your body fighting it. It's those dead white cells that are trying to help you out and heal you. And those pustules that are caused by acne can sometimes become hard or painful. And when that happens, they actually become a cyst. And this is called cystic acne. That is one of the most extreme forms of acne, and it can be very painful and hard to get rid of. So in general, when we're trying to tell when pustules need medical attention, that's generally going to be when they erupt all over your face or in patches all over your body or just in multiple places on your body. That can indicate that you have a bacterial infection. So if you have a sudden outbreak of pustules, then you might want to talk to your doctor. You may also want to talk to your doctor if they're painful or if they're leaking some type of fluid. That could mean that you have a serious skin infection. If you have pustules and a fever or warm skin in the area of the pustules, or your skin's clammy, or you're nauseous, vomiting, have diarrhea or pain in the area that has the pustules, then you may want to go to the emergency room ASAP. That can be indicative of a much larger problem. Now, a lot of pustules go away without treatment, but if you have small pustules persisting on your body, then it can be helpful to wash your skin using warm water and a mild facial cleanser. Do that twice a day to help remove oil buildup, because that's the main cause of the acne. Make sure that you are using your fingertips instead of a washcloth to clean your face, because if you scrub a pustule, you can further irritate your skin. You can also cause it to erupt and potentially infect other parts of your body. You don't want it to burst and result in a worse infection. Now, you can use over-the-counter acne meds, soaps, and creams to treat small pustules. And the best treatments for that are going to have peroxide, salicylic acid, and sulfur for those. But if you're having these pustules near your genital area, do not use those specific treatments near your genital area. If you have a sulfur allergy, you also do not want to use products that have sulfur in it. Read those labels. Over-the-counter products can also help treat those pustules just by drying the top layer of your skin and absorbing excess oil from the surface of your skin. Some products, though, may be a lot stronger than others, and it can make your skin dry and even peel or flake. So if you have sensitive skin, check for products that are made specifically for your skin type so that you are using products that are making your condition better instead of worse. Also, avoid oil-based products like lotions or petroleum jelly in areas that you have pustules, because that can just further block your pores and you can end up with even more pustules. All right, we're going to go on a quick break, and when we come back, we are going to talk about cystic acne and some good treatments. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
In our last segment, we were talking about papules, pustules, nodules, and cystic acne, the forms of inflammatory acne. So now we're going to talk a little bit more about cystic acne, as well as some good products that are recommended by dermatologists. Now, cystic acne, as we discussed, develops when you have a cyst form deep underneath your skin, and it's usually a combo of bacteria, oil, and dry skin that got trapped in your pores, and the bacteria is munching on that oil and just generally giving your body a hard time. So anyone can develop acne, but cystic acne in particular tends to occur mostly in people who have oily skin, which is also why teens, women, and older adults with hormone imbalances tend to get it. So cystic acne, though, can improve with age, but those painful bumps are not going to just go away on their own. If you think you have cystic acne, you should really speak with a dermatologist to get some prescription meds that are necessary to help clear that skin up. So if you're trying to identify whether or not you have cystic acne, it tends to be very large in size and also a lot deeper under the skin. All the other types of acne tend to be a lot closer to the top of the skin surface. Cystic acne can also look like boils on your skin. It may be a large pus-filled cyst, or it looks like a large white bump. There may be redness and inflammation around it, and that can also make it painful to be touched in that specific area. So acne cysts are usually the most noticeable ones, and they're more noticeable on a person's face. But you can also get them on your chest, your back, your neck, your arms, your shoulders, behind your ears, pretty much anywhere that you have pores, you can technically get cystic acne. Now, there are several treatments for it, but since it's so severe, over-the-counter treatments tend to not be strong enough. So you do want to see a dermatologist for prescription meds for this. It's going to depend on the type of treatment that you use as to how long it takes for you to see full results. But it may take up to 8 weeks to 3 months. Just talk to your doctor about the methods for it and see what works right for you. Some folks do have combination therapies. One of the most common medications that folks are familiar with is Accutane, also called isotretinoin. It's a very powerful prescription med, and it's the most effective treatment measure for cystic acne. It's made from a very powerful form of vitamin A, and you take it as a pill each day. About 85% of people who take it have improvements in 4 to 6 months, but there can be some serious risks associated with it. Remember, in a previous segment today, we talked about how getting too much vitamin A can be very harmful for your body. So if you have new or worsening mood disorders, IBS, headaches that are persistent, or you're getting nosebleeds, bruising, skin inflammation, blood in your urine, or muscle and joint pain, then you need to talk to your doctor about that if you are on isotretinoin/Accutane. Those are some very strong side effects, you guys, and you especially are not supposed to be taking that if you are pregnant or looking to become pregnant. Oral antibiotics may also be used to treat cystic acne, especially if it's covering a large area of your skin. And these help by decreasing bacteria and inflammation that might be contributing to these acne cysts in forming. But the antibiotics don't work to take away any of that excess oil or remove those dead skin cells. So this is only really addressing the bacterial component. The antibiotics are generally also only used short term because the bacteria can get a resistance to it. So if the antibiotics aren't effective, then your doctor is probably going to recommend you start taking isotretinoin. You can get possible side effects with oral antibiotics for acne, just like you can with any other types of oral antibiotics for other reasons. And that includes abdominal pain, nausea, diarrhea, vomiting, and even sun sensitivity. I have experienced sun sensitivity with my antibiotics, and it's super weird, you guys. If you haven't experienced it before, it can make your skin kind of feel like it's burning a little bit. It's not quite like a sunburn, but in a way it sort of is. And it can also make you more likely to get sunburned. That's just the way it goes. So with the isotretinoin, you may end up with more sun sensitivity, and you may also end up with that with the antibiotics. In addition to antibiotics and Accutane, they may also have you use topical retinoids. Remember, those are also made from vitamin A, but they're not nearly as strong as isotretinoin. They do work, though, by unplugging those hair follicles to remove and prevent severe acne. So you may use this in combination. So using an oral antibiotic to help remove that bacteria, and then also using the topical retinoid to unplug that hair follicle to remove and prevent the accumulation of that oil and the dead skin cells that are also causing the problem. So a lot of times you can use these topical retinoids on a daily basis, and they're in the form of creams, gels, or lotions. So they do have them in different forms like gels if your body is more sensitive to those creams and lotions. And one over-the-counter retinoid is currently available, but cystic acne is usually only responsive to prescription strength ones. So you want to make sure that you are going to talk to a doctor about that. Using those topical retinoids can make your skin more red, and it can cause it to peel. But the good news is those side effects are usually temporary as folks' skin gets used to the medication. Interestingly, there's another medication called spironolactone or aldactone, and it's used for cystic acne, although it's usually used as a diuretic to help treat edema and high blood pressure. So that's usually a totally different type of medication, but it has a really cool cross feature of helping out your acne by managing any excess androgen levels, those male hormones that could be contributing to inflammatory acne. Generally, it's only effective in women who have acne on their jawline or lower face. So there is a very specific use case for this as an acne medication. It can cause birth defects, though, because it's messing with your hormone levels. So if you are pregnant or planning to become pregnant, you do not want to be on this medication. Also, if you have kidney disease, you should not be using this medication at all. In 2012, some researchers found that doses of 50 to 100 milligrams per day work best, but it is not uncommon to be on a prescription of as high as 200 milligrams per day of this medication to help with acne. Side effects may include breast tenderness, dizziness, fatigue, headaches, high blood potassium, and menstrual irregularities. So high blood potassium is called hyperkalemia, and those menstrual irregularities could be anything from spotting to having your period be irregular and many other ways. So those are several of the types that you can use to treat it. You can also use oral contraceptives to treat cystic acne as well. But do keep in mind that just as you do not really want to be taking oral contraceptives if you are a smoker and you're taking the contraceptives for contraceptive use, if you smoke or have blood clots or are trying to get pregnant, you still should not be taking these oral contraceptives for acne either. Now, cystic acne is the most likely of all the types of acne to scar, and if you pick at it, it is going to make it even worse. So picking or popping at the cysts with cystic acne is a lot worse generally than trying to pop those pustules or even going through and doing blackheads. If you go ahead and pick at this type of acne, it is particularly more likely to spread the infection and make it worse, and also to scar. So you definitely do not want to be picking at cystic acne. We aren't even going to play like we're Dr. Pimple Popper with cystic acne. Now, if it does scar though, there are some treatments that you can try to reduce the appearance of those acne scars. But you want to try to prevent the acne to begin with, treat your current acne, and then address the scars after your acne is already under control. So you can do chemical peels or go get dermabrasion or laser resurfacing from a dermatologist. You should not be doing these yourself at home necessarily, unless you are trained perhaps to do these. So that really means for you that since it can take several months to get rid of cystic acne, to get it under control and to manage it, that it may take you 6 months or more in order to get that to the point to which you can address those scars. Don't address it too early or you can make it worse. We don't want to further irritate our skin at that point and potentially make it more susceptible for the spread of that cystic acne. I know it sucks in the meantime, but just be patient and take your medication consistently. Apply those retinoids or whatever your doctor has prescribed for you consistently. And after several months, you should hopefully be able to have it under control and talk to your doctor about whether at that point it's a good time for you to go for a chemical peel or dermabrasion or laser resurfacing if that is something that you want to do. Preventing cystic acne works the same way as preventing all the other types of acne. You also want to make sure you are working on ways to alleviate stress and cope with stress because that is linked to acne outbreaks. And wash your face and body after you work out to remove any oil and bacteria that may be chilling there. Regarding some good products to help you out that dermatologists recommend, there is a great list on NBCnews.com called The Best Skincare Products for Acne-Prone Skin According to Dermatologists. For the most part, it talks about products with salicylic acid and benzoyl peroxide to help prevent clogged pores to begin with, and also how to clear them up if you have a breakout. These products include Neutrogena oil-free salicylic acid acne-fighting acne wash, as well as acne-free blackhead removing scrub with salicylic acid acne treatment. The brand is called Acne-Free, one word, and that one's only like $8. So it looks like you can also get it from Walgreens, Walmart, or since we are in the era of social distancing, you guys, you can get it on Amazon. This one has charcoal and salicylic acid in it, so it's both an exfoliant and has that salicylic acid to help unclog your pores. You don't want to use this with inflammatory types of acne though. So just blackheads and whiteheads, not the pustules, papules, nodules, or cystic acne. It's also a really good alternative to benzoyl peroxide if that's something that your skin does not like, because some folks' skin just doesn't like benzoyl peroxide. So you're going to want to go with something that has more salicylic acid instead. Now, there are also face masks that you can use for this, like the Neutrogena Clear Pore Facial Cleanser / face mask. It has bentonite clay in it. So remember, we are wanting to make sure that we are using things that our skin personally likes, and what works for one person may not work for another, and that's totally okay. Maybe hand it off to your friend and let them try it instead of just tossing it out, and maybe that'll work better for them. You can also use toners to help remove those pore clogging debris in your skin, and some of them are really chill. Like, you can use a witch hazel toner if you're into more natural stuff. This Dickinson's original witch hazel pore perfecting toner is 100% all natural, if that is your thing. So there are a ton of different options for you. There's also calming and balancing facial moisturizers. There's sunscreen that is for sensitive skin and acne prone skin. And they also have things like zinc oxide in them to act as an anti-inflammatory and not promote the production of more oil on your skin. There's also weirdly facial oil. So if you're using something that is causing your skin to be more dry, it may actually be good for you to use it to treat blemishes. It's kind of a fighting fire with fire principle. Even though it sounds counterintuitive to put oil on your face if you have acne, this specific type, it's called Herbivore Lapis Balancing Facial Oil. You can get that from Sephora or Amazon. This one's quite pricey. It's $72, you guys, for a small container of it. But it has a specific formula in it that includes blue tansy, and that is an antibacterial and anti-inflammatory agent. So it's going to help reduce the redness associated with your acne. And there is a kukui nut oil in it that also balances the production of sebum, or that natural oil that's really produced by your sebaceous glands for the health of your skin and your hair. If you want to try a drying mask, there's also some that have sulfur and zinc oxide in it. Just make sure you're checking the labels to ensure you're not getting something that's going to cause your body more harm. So if you have a sulfur allergy, just know that some of these masks and acne products can have sulfur in them as well. You can also do peel-off masks. Those are some of my absolute favorites, you guys. I remember Avon had a bunch of them when I was a kid. And you can also get them from Aveeno. They have the Aveeno Clear Complexion Peel-Off Face Mask. It is $5.17 on Amazon. And it's about 0.35 ounces. So it's a single-use mask. Just keep that in mind. And you don't have to rinse or anything with it. It's just really gentle, and it targets pimples and can help you with inflammation reduction. So go ahead and check out this website. The article is by Christina Heiser on the NBC News website in their wellness section, and it's called The Best Skincare Products for Acne-Prone Skin According to Dermatologists. They actually have a full discussion with dermatologists in there as well. And at the end, it has a list of all the products and specifically what they do for you, how much they cost, and where you guys can find them. So I highly recommend it if you are looking to start a different direction in your acne journey. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.